Hi guys, this is Medical Science Lecture. I am very delighted to have you back. In this channel, we teach our viewers about medical conditions, or we give them medical tips, or medical education, even at the comfort of their living room. This is to enable our viewers stay healthy. In addition to that, we run classes or lectures for students of physics, chemistry, and mathematics. But for today, I want to take you through an important aspect. This is the signs of pregnancy. I want to tell you those signs you see, and immediately a woman sees those signs, she will be convinced she is pregnant. Why is it important? Many women have become pregnant without knowing, and because of that, they may have taken drugs they shouldn't have taken, especially during the early days of pregnancy. You're supposed to avoid drugs as possible. But most women, because they do not know they are pregnant, they take drugs, leading toward loss of pregnancy. Which is why I have deemed it necessary to tell you today the signs, those things you see. Immediately you see them, you'll be sure you're pregnant. That forms the basis of today's discussion. Once again, my name is Dr. Godwin Obono. You're welcome to this channel. In case you're new to this channel, please hit the subscription button, turn on your notification bell so that once new videos are made, you'll be forced to be notified. Again, share and like the video. Let's begin. Welcome back. It is actually important to know when you're pregnant. Not every woman knows when she is pregnant. Not every woman. Some may be pregnant, they don't know. And what is the risk? The risk is that at that early stage, they may end up taking drugs they shouldn't have taken. Normally, during the pregnancy is divided into three, we have what we call the first trimester, second trimester, and third trimester. The first 3 months is a very important period of pregnancy, meaning that a woman must avoid any intake of any drug. But for those who do not know that they are pregnant, within the first few weeks, because they do not know, they may end up taking drugs, and that may either lead toward them losing that pregnancy, especially for those who want to get pregnant. Now, so there is need for a woman to know when she is pregnant. So there are things she has to see. There are signs a woman has to see that will make her know that she is pregnant. The first is what we call the missed period. I want to again say missed period is not really reliable. It could be reliable, may not be reliable, depending on if a woman has a regular menstrual cycle. For women with regular menstrual cycle, when they miss their menses, of course, for such women, some of them may get worried, especially for those who are not expecting pregnancy, who do not want to get, maybe accidentally it happens. So for such women, they will become worried because they have missed their period. And that's because such women have regular menstrual cycle. That's to say, every month they have never missed. And for those women who have regular menstrual cycle, for instance, a woman has 28 days cycle. Every month she keeps saying within 28 days she must have seen her menses. For 6 months, if it happens like that, where the number of days has not changed, you say that woman has a regular menstrual cycle. For such women, every month they kept saying their menses about 28 days. So anytime that doesn't happen, then such a woman will conclude that she is either something has gone wrong, especially if she has had sexual intercourse previously. So, but for those who have irregular menstrual cycle, such women, they may not know when they are even pregnant, because sometimes they miss their period, yet they are not pregnant. Some of them have 21 days, some 28. For this month it might be 21, the next month 28, the next month like that. So there is no the date kept changing, and when that happens, you say the woman has irregular menstrual period, and sometimes they even miss their menses. In other words, sometimes they don't see, they don't experience have menstrual bleeding some months. So yet they are not pregnant. After maybe missing, the next month they will begin to see again. Such women using missed period, it's really unreliable, because they may miss, yet they are not pregnant, because it has always happened that way. But for those who have regular menstrual period, because they have never missed, every month they will see their menses. So anytime they don't see it, especially if they've had sexual activity or sexual intercourse previously, they will be worried about the fact that they have not seen their menses. And so for such women, once that happens, they can conclude that they have missed, they are pregnant. Now, the second thing you may look out for is that for some women, they may have the breast. Once that happens, you see early signs. You see the breast may become larger, heavier. Sometimes you see, if you touch it, to touch the breast become tender. That's what it will be painful. That's what we call tenderness. And the nipple becomes darkened. Sometimes the nipple will stand out. So once you see that nipple standing out, you see the breast becoming heavier or larger, and then you see also tenderness or pain when you touch the breast. When you observe such signs, of course, it's another sign that that woman is pregnant. Again, most of them have this feeling of sickness. In other words, you see them feeling as if they are sick. They will tell you, I'm not feeling fine. Now, one of the things they observe or experience during that time is they may have nausea, they may have vomiting. But I want you to know that shouldn't be a problem. If you're vomiting, please vomit. If you're vomiting and you're nauseating, it's not a problem, because it won't be a threat to your pregnancy. It will not threaten your pregnancy. But when it becomes severe, when it becomes very severe, that's what we call hyperemesis gravidarum. Once it's severe, please, because when it's severe, it can cause the woman to become more dehydrated, and it will also cause the woman to become malnourished. And once that happens, please let that woman seek medical attention, because there may be another thing that triggers that vomiting, not necessarily the pregnancy. But if it's a pregnancy associated vomiting or nausea, there is nothing to worry about, because it will not threaten your pregnancy. But what I'm trying to tell you is that for a woman who is pregnancy, the woman begins to see vomit, she vomits, or she have nausea, and she have this feeling that she is sick. And some people call that morning sickness. So that's another sign that the woman is pregnant. Now, another thing is, some of them, you see them having frequency in urination. You see them within a short time, they go to urinate, they go back again. At night, they wake up, and you see, like that, frequency urination. Some even have constipation. Some have vaginal discharge. Here, I want you to know, once there is vaginal discharge, please, provided the vaginal discharge is not associated with itching, or blood, please, there's nothing to worry about. You see, but once you see the vaginal discharge is associated with itching, with pain, and all of that, so please, if the discharge has other association, please, it's a thing to worry about, because it might not be the pregnancy that is causing it. It could be an infective process. So for such people, you quickly alert your health provider. Now, again, another sign a pregnant woman may observe or experience is what we call implantation bleeding or light spotting. Now, you see, for such women who are pregnant, especially during the early days or early weeks, between the period of let's say 10 to 14 days, you notice that the woman will see spots of blood on her panties. Some women confuse it for menstruation. It's not really menstruation, because there's no flow. It's just blood spots on their panties. And once that happens, that place, you should know that what is happening in your uterus, or in your uterus, is simply implantation. that when that happens, it coincides with the implantation of the embryo. So please, the implantation of the embryo will cause some of these women who are pregnant to have blood spot on their underwears, and sometimes they also have pain below their abdomen, you see. So that is what we call implantation signs or symptoms: pain, and also light bleeding or light spotting, you see, light spotting. So that some women observe that. Again, like I told you earlier, some women may not observe it, may not see that, but they may see other signs or other symptoms. Another symptoms is fatigue. Some women get fatigued, they get tired. Some women who are pregnant also may have cravings for certain food. Some of them, they crave for food that are not healthy, while some crave for food that are healthy. Some even crave for or have urge for things like substances like chalk, like clay, and for such women we call that condition pica. We call it pica. It's actually not normal. For such persons who have craving for things like that, it may likely be that they are having lack of vitamins, or maybe there is evident severe anemia. So, but normally there is craving for certain things, some of them for healthy food, some for unhealthy food. So for pregnant women, some have craving for things, they have urge to eat certain things during the time of pregnancy. Then again, tiredness. Some of them they get tired easily. You see, again, at this point, I want you to know that these signs or symptoms that I've mentioned, I've given to you, are not specific for pregnancy. You also can see them in some other medical conditions. For example, vomiting, you see that in typhoid. You also see urination, frequency urination for somebody who has diabetes. So it therefore means that these signs may not be specific for pregnancy. So seeing them, when you observe all of this, it may not be enough to conclude that you are pregnant until you do what we call the pregnancy test. So the pregnancy test is something you can do even at the comfort of your home. You can get the pregnancy test strip, and either you can use a urine do the urine test, or the best test is the one that involves the use of blood. So, but the most important thing is that you can eventually confirm that you're pregnant by going for a test. That test will confirm to you that you're positive for pregnancy. So at this point, I want to believe that you have understood the signs of pregnancy. Please, for those who are expecting to get pregnant, and even those who are not, there is need for you to have understanding of these signs, this manifestation of pregnancy, so that once you are pregnant and it's been confirmed with your test, your pregnancy test, you need to quickly contact your healthcare provider. So at this point, if you find value with this video, please subscribe. Also, do not fail to turn on your notification bell so that anytime new videos are made, you'll be notified. Again, like this video and share. Thank you.